Hello and welcome to our city-county COVID-19 press briefing. So the lineup today is going to be the Nueces County Judge, Barbara Canales, will start, and then I will follow and give the COVID-19 statistics as well as what is going on at the health district and our mega vaccination drive-throughs, and then we will follow it up with question and answers. So now I'll turn it over to Judge Canales. Thank you.
Well, good afternoon. Thank you again, Barbara Canales, Nueces County Judge. Today I'm here to give you an update on what we are doing collectively to help get vaccines to everyone who wants one. And of course, at this moment in time, everybody who's eligible. And this, of course, is starting with our most vulnerable, the over 65 population, and those with chronic conditions over the age of 18. Of course, in addition to those 1A medical personnel, firefighters, first responders, and others who really put their life and health on the line every single day they go to work. So today I'm really here to say, guys, I'm proud, but I'm also a little disheartened. It's important to share honestly our emotions because together, through honesty, we find integrity. I'm very proud of the efforts of so many to make our vaccination mega clinic a success. And it's okay to say that we are frustrated or disheartened by the lack of vaccines to expand our efforts beyond the mega clinic. And today, I believe I am disappointed a little bit further by the fact that we have not received the vaccines yet that we thought were coming yesterday. So, as a result, the mayor, when she arrives, will be giving to you up-to-date information about our plans for this week. But let me start with some good news. Last week, with 4 days of operations, we were able to administer 9,000 doses of vaccine at our drive-through mega clinic. Now, this mega clinic, this hub, this regional hub designated by the state of Texas, does not discriminate. It does not discriminate by city, by county, or even state. We are this regional mega center, as I said, designated by the state of Texas, and we're on a very specific mission, and we're proud to serve. But it is inside our charter and a contract with the state of Texas to serve our region. Now, here's some great stats. We served 9,380 people last week from over 51 counties. That's incredible. By the way, I should leave my glasses on. It's 9,380, sorry. 9380. It's important to note that when you do the math and you look at the reports, that 76% of the people we served were from Nueces County. And just as Nueces County's population mostly resides in Corpus Christi, most of the people were served from Nueces County were from the city of Corpus Christi. Now, that might sound like speculation, but let me just tell you, I've run the reports, and it's accurate. So out of that 7,380, 7,100 came from zip codes inside the city of Corpus Christi. In other words, this mega clinic, this regional hub, is operating exactly how it should. It's delivering the most vaccines in the least amount of time to the most vulnerable people in 1A and 1B, and it's following our Texas vaccination plan. Here is a big word. However, let me say that again. However, the mega clinic does not serve many people who fall into these categories. In other words, there's gaps. It's not for everybody. It's not even good for sometimes for those that fall into 1A and 1B. Who doesn't it serve? Well, it doesn't serve those who can't travel to the mega clinic. It doesn't serve the homebound. It doesn't serve those without transportation. It doesn't serve those who cannot remain sitting in the car for an extended period of time. And the mayor has rightly understood and identified that all of those are gaps, and we need to fill them. And we have developed plans and programs to serve those who cannot travel to the clinic. And these were not always contemplated, but these were actually written, documented plans. The problem is, as I've always said, we have a high volume of demand and a limited supply of vaccine. Fortunately, we know who many of these people are. And we know because we will have the opportunity through our social services and through some of the programs that we have pending, not pending, but we have operational, both the city level and the county level, how to identify these groups. And so today we spent countless hours together, city and county, working on the identification of these vulnerable folks that aren't able to be at this clinic. And we worked on plans, city and county, on how we're going to address this need. And our mayor will share some of these plans with you a little bit today and more in the future. But again, many of the homebound are already enrolled in programs that serve their medical or dietary needs. Some of these I've mentioned before, Meals on Wheels, but that's not the only list or registry. And I want to thank and do a special shout out to Jana Shu today from 211, who helped us identify an important registry for those who receive homebound services through home health agencies. Our Corpus Christi Fire Department has a plan, and we've made this available through other press briefings. You remember Chief Quinteto came and talked about that plan, gosh, it seems like weeks and weeks ago, that EMTs, who are also firefighters, will be able to make these house calls. So many of our seniors who cannot travel for long periods of time are making daily trips to pick up meals. And I'm sorry, many of those who care for our seniors are making daily trips to give them their meals, and others travel for other reasons for medical attention. But at any rate, the goal is very clear. Work within our community to reach these people who have a greater degree of mobility and meet them where they are going. So wherever they are going, we want to be there in the future. And of course, all of this is dependent on availability of the vaccine. And so, as I said, your city leadership will be able to announce plans when we have vaccines available to provide them. Now, tomorrow at noon Eastern Time, or approximately, a new president will be sworn in. And President-elect Biden has stated that he will deliver 100 million vaccines in the first 100 days in office. Now, no matter what your political party is, you have to have hope that our new president can achieve this goal. We want to root for this goal because the faster we can get vaccines distributed to us, the faster we can get them distributed to you. That's the goal. Faster to us, faster to you. And as vaccine production is increasing, a third vaccine from Johnson & Johnson is expected to be approved within the next few weeks. This is, quite frankly, very exciting news. We had a very productive call this afternoon with city leadership, city county health, and all of those supporting our efforts to expand vaccine access. We have proven over the last week that we can deliver vaccines at our mega clinic in volume. And I know that all of the plans that are in the works, from home delivery to holding vaccine clinics at community centers, they're going to benefit from the success and the lessons that we've learned during this last week, delivering 9,380 vaccines in 4 days. So let me end how I began. I'm proud of that work. But make no mistake, I'm always going to be disheartened when we're not tending to everybody's needs. And so I thank you for all of your emails, your texts, and your calls that share with me the humanity of what we are dealing with together. It reminds me that we need to work harder for greater access. It reminds me that as proud as we are, we're not covering everyone. And so, again, what disappoints me is that I've walked those lines with cars at the fairgrounds, and I've met those who are waiting in line to get the vaccine. and those who are being observed after the vaccine. And what I can tell you is that I have seen the hope, faith, and yes, the fear in the eyes of those waiting in line to get the vaccine. But I also see the relief, the comfort, the calm, and the peace that the vaccine provides. I've said that administering these vaccines as a public official feels like I finally get to play offense after a year of playing defense. Quite frankly, a year of exhaustion of being on the field only in one direction. But for those who get the vaccine, I see the look of people who believe that that shot may have just saved their life. And I want everybody to have that same feeling, that same opportunity to feel that way. This week, we hope to hold another mega clinic at the fairgrounds, and we're going to hear in just a moment more information about that. I can tell you now that by working together, we have made great improvement on processes, serving literally on Saturday 2,500 people by 1:30 p.m. That was just a record. And so I'm committed to this regional hub on behalf of the state of Texas. I'm committed to being a model of efficiency and effectiveness. I'm committed to continuing the perfection and the curing of problems at that site. And I'm committed to continuing to work together as a team to deliver great results. But I know, and I want you to know that I know, that we're not doing enough. Everything we've done that's so amazing, it's still not enough. And I need you to know, and I need you to hear, and I need you to feel and see it in my eyes that I'm with you, that I know it's not enough, and we're going to push harder. We're going to work longer hours. We're going to do everything we can to make it enough in the coming weeks and months that lay ahead. We're proven that we can deliver. The state of Texas has recognized our efforts, and that's what happens when they keep sending more and more vaccines and they keep increasing our allocation. But please make no mistake, as we close today's comments on behalf of the county, we cannot deliver what we do not have. I pray every night, in the morning and in the evening, that the availability of the vaccines will increase. It's become my daily meditation, and I hope you will join me in that prayer for our community. I hope and pray for our new president that he can fulfill the promise with his team to deliver 100 million vaccines in 100 days. And I commit to all of you that we will be ready when they arrive. As our mega clinic is in your community and we devise new ways to deliver to your homes, we will get them to you as soon as we can. We know you are counting on us. We will not let you down. Thank you.
Estoy algo frustrada ya que aún no hemos recibido las vacunas que estaban destinadas a nuestro condado. La semana pasada, con 4 días de operaciones, pudimos administrar 9,000 dosis de vacunas en nuestra unidad a través de la megaclínica. Nuestra megaclínica no discrimina por ciudad, condado o incluso estado. Somos un megacentro regional designado por el estado de Texas. Servimos a 9,380 personas de 51 condados. Aproximadamente el 76% de las personas a las que servimos eran del condado de Nueces. La megaclínica está funcionando como debería, vacunando a los más vulnerables, los del grupo A, 1A y 1B. Sin embargo, la megaclínica no atiende a muchas personas que entran en esas categorías. No atiende a quienes no pueden viajar en la megaclínica, no atiende a quienes están confinados en sus hogares o a quienes no tienen transporte. Por lo que hemos estado desarrollando planes y programas para atender a quienes no pueden viajar a la megaclínica. La alcaldesa va a tener detalle para esos planes. El Departamento de Bomberos de Corpus Christi tiene un plan para utilizar a sus bomberos capacitados para realizar visitas a domicilio. Todo dependerá del número de vacunas con las que contemos. El presidente electo Joe Biden ha declarado que entregará 100 millones de vacunas en sus primeros 100 días en el cargo. En cuanto más rápido nos lleguen las vacunas, más rápido podremos distribuirlas a todos ustedes. Hemos demostrado que podemos entregar vacunas en nuestra megaclínica en volumen. Al entregar las vacunas a 9,380 vacunas en 4 días, Quiero agradecerle a todas las personas que me han escrito y así seguiremos trabajando mejor. Me reuní con algunas personas que estaban esperando en fila para recibir su vacuna y puedo ver el alivio, el consuelo y la calma que proporciona la vacuna. Esta semana esperamos realizar otra megaclínica. Tan solo el sábado atendimos a más de 2,500 personas alrededor de la 1:30 de la tarde. Pero no podemos ofrecer lo que no tenemos. Espero que la disponibilidad de las vacunas aumente pronto. Espero que nuestro nuevo presidente pueda cumplir con la promesa de entregar los 100 millones de vacunas en los primeros 100 días. Y me comprometo con ustedes a que estaremos listos cuando estas lleguen.
Thank you. So I'm going to go ahead and start with the Nueces County COVID-19 statistics. And on the first slide you see here to my right, you see 2 weeks of COVID cases. The first week ending January the 12th, 2021, right in the middle there at the 182 and 257, 1,384 COVID-19 cases in Nueces County in 1 week. The second week starting with 257, 301 cases, 1,369 COVID cases this past week. As predicted, the winter has caused increased cases of COVID-19. And this is our second wave. Next slide, please. If you look at the pie diagram, you see 29,450 people that have recovered in Nueces County from COVID-19, but the concern is the 3,128 active cases of COVID-19 currently today, and an additional 611 people that have lost their lives, for a total of 33,189 COVID cases since March of 2020. Next slide, please. The hospitalizations continue to go up and down, but they have definitely peaked. And sometimes you see on a Monday, it seems like those cases are higher than what you see over the weekend. But again, if you look at those cases on the far right, 175 patients hospitalized with COVID-19. In the last 2 days, we've had 193 patients and 187 patients hospitalized just because of COVID-19. Next slide, please. These are the patients in the ICU with COVID-19. We do know that patients that are in the ICU, sometimes they will not make it out of the ICU because of the illness itself. It's in the 50s, and that continues to be very high numbers for people in ICU related to COVID-19. The last 2 days, 54 for the last 2 days, the patients in the ICU. Next slide, please. So the total deaths, as I mentioned earlier, 611. As you can see by the slope, the numbers continue to rise on a daily basis. There's 3 additional deaths today. Our condolences to the families that lost those loved ones due to COVID-19. And the last slide shows the deaths over the last 2 weeks. If you split those right where January 12th and January 13th is, the first week all the way to the right, there was 29 deaths last week due to COVID-19. This week, 21 deaths due to COVID-19. Today, there was 2 females, 1 male in their 50s and in their 60s. So I'm going to talk a little bit about today what the health department's been doing with the help of so many people to try to get vaccines into our community. So as of today, the health districts has had 4 COVID-19 mega vaccination drive-thrus. The majority of those vaccinated are 65 years and older. Vaccinating over, as the judge mentioned, 9,000 people in less than 1 week. About 60% of those people that came through our drive-thru were females, and approximately 40% were males. Most individuals vaccinated are from Nueces County, followed by some other counties with high numbers that actually attended our drive-thru: San Patricio County, Jim Wells County, and Clayburgh County. We had individuals come from 51 different counties in Texas, as well as from out of state, to go through our mega drive-thru clinic. The mega drive-thru clinic uses vaccines that are specifically provided to us with no jurisdictional restrictions. We were allocated 5,000 vaccines for the next mega vaccine drive-through. Allocation basically means that the state has set them aside for us, but it does not mean that they have been delivered. Our goal is to be able to receive them and then the following day to have the drive-through clinic. We ask the public to be patient with us as we will work to refine our processes. We are following the state's request to vaccinate with a sense of urgency, which there is. Individuals need to understand the importance of getting their second dose. Second doses for people that have come through our drive-through clinic are approximately a month after their first dose. And the reason I say that have come through our drive-through clinic is because we have a particular vaccine that we give. We give Moderna. So you cannot mix vaccines. So if you've come through our drive-through clinic, in about a month, you're going to need to be coming back for your second dose to get that 95% protection. Do not try to take both doses within a few days of each other. We are hearing of individuals that are going to one county or going to Keansville or Clayburgh, and then a few days later they want to come to our drive-through and they just want to get it over with, 2 doses. It doesn't work that way, and that's how you end up with adverse reactions. At least 30 days. It could be a little longer. It could be 40 days. You're still going to be okay, and you're still going to get the protection. So that's very important. There are vaccines, and they're coming in. I know they're still trickling in, but there are additional vaccines coming in every week. The public is asking, when will we know when the next mega clinic will take place? And I understand how stressful it is not to know. We're also feeling the same stress at the health district, not knowing, not getting shipping information, and so we're waiting anxiously like you are. But if you follow the social media with the City of Corpus Christi, as well as nuecesknows.com, or you go to our website at www.cctexas.com/coronavirus, we have a new tab called Vaccine Information. It can help give you more information as to when those doses arrive. We want to thank everyone that's been involved in these mega vaccination operations. This is an operation of a scale that you couldn't do alone. So we have partners that are both city and county partners. We also have Robstown Sheriff's Department. We have the Robstown EMS there, Texas A&M, Corpus Christi, Richard Borchard staff that are amazing people. They actually got music in the show barn for us this last Saturday, which really helps to be able to just keep going, keep vaccinating, keep doing what we need to do. CCPD, CC Fire Department, all the nurse volunteers, and many, many others. So thank you to all of them. As a reminder, vaccination distribution continues to be a phased approach. Phase 1A, Tier 1, and Tier 2 includes hospital staff, long-term care staff, EMS, home health care workers, and residents of long-term care facilities, as well as the employees. Phase 1B includes those 65 years of age and older, and those 16 years of age and older with a comorbidity or a chronic medical condition that puts them at an increased risk of getting COVID-19. We have received concern about getting the COVID-19 vaccine to those individuals that are homebound. We're working closely with the Corpus Christi Fire Department on a plan to reach populations that cannot physically make it to the drive-through. For the providers who have not gotten vaccinated already, I would advise you to please come through one of our drive-throughs to receive your vaccine. If you are a physician who still has not registered to become a COVID-19 vaccine distributor, you can call DSHS at the provider hotline, 877-835-7750, or you can also visit our website at cctexas.com /coronavirus, and you can sign up under the COVID-19 How to Become a Provider. As we continue to vaccinate with a sense of urgency, we advise everyone to continue following the public health prevention strategies. Continue to wash your hands. Continue to wear a mask and practice social distancing. COVID-19 is still amongst us and will be until everyone that is eligible is vaccinated. Stay healthy, stay protected, and stay informed. Thank you.
En las últimas 24 horas se han reportado 166 casos confirmados por el coronavirus. Tan solo en la última semana esos casos totalizaron 1,359. 29,450 pacientes se han recuperado por completo, 187 continúan en el hospital, 54 están en la unidad de cuidados intensivos, 3,128 son casos aún activos. El día de hoy se reportan 3 fallecimientos. A la fecha los fallecimientos totalizan 611 personas. El Distrito de Salud ha llevado a cabo a la fecha 4 megaclínicas de vacunación contra el COVID, vacunando a más de 9,000 personas. La edad media de los vacunados es de 60 años. De los vacunados, el 56% han sido mujeres y el 44% han sido hombres. La mayoría de las personas vacunadas son del condado de Nueces, seguidas por los condados de San Patricio, Jim Wells y Clayburgh, aunque hemos visto a personas de todo el país. Las clínicas utilizan vacunas que fueron asignadas especialmente al condado de Nueces para que se puedan proporcionar a nivel regional. Para la próxima campaña se nos asignaron 5,000 vacunas, o sea que están destinadas a nuestro condado, pero han habido algunos retrasos para que las traigan a este condado. Recuerde obtener su segunda dosis un mes después de haber recibido la original, no antes. La vacuna solamente será efectiva cuando se tomen las 2 dosis de la misma compañía fabricadora. Actualmente, la forma en que el público sabrá cuándo se llevará la próxima megaclínica es siguiendo las redes sociales con la ciudad de Corpus Christi. Allí publicaremos cuándo se llevará a cabo la siguiente clínica, o también puede hacerlo visitando nuestro portal de internet a la dirección www.cctexas.com/coronavirus bajo información de vacunas. Quiero agradecer a todas las personas involucradas en la realización de estas operaciones. También estamos trabajando en un plan para que paramédicos del Departamento de Bomberos administren la vacuna a los residentes del condado que se encuentran confinados a sus residencias. Si usted es un proveedor que aún no se ha registrado para la distribución de vacuna, llame a la línea directa de proveedores de vacunas al número 877-835-7750. Mientras los esfuerzos para continuar con la vacunación sigue, le pedimos que siga tomando todas las medidas de prevención. Use un cubrebocas, lave sus manos seguido y mantenga su distancia de otras personas.
Good afternoon, everyone. My name is Mayor Paulette Guajardo. I first want you to know how much we appreciate everyone's patience, as was said before, as we work diligently as a very strong team to make sure that everyone in Group 1A and 1B have access to the vaccine. As mentioned earlier, there will be no COVID-19 vaccination clinic tomorrow, Wednesday, January 20th. The COVID-19 vaccine shipment from this state has not yet arrived, and we are also monitoring weather conditions. We anticipate a mega vaccine clinic on Thursday at the Richard Borchard Fairgrounds, where our goal is to deliver 5,000 vaccines to individuals in groups 1A and 1B. I am also working with city staff and our health department and county on behalf of your city council to bring a vaccination site inside the city limits of our city for residents that cannot travel to the fairgrounds in Robstown. And I'd like to tell everyone that we are seeing your messages, we are reading them, and we understand that frustration. And we are here also to help move that endeavor forward. So again, your council district representatives and myself are seeing, and we're getting your emails, and we understand the importance of not being able to go to the fairgrounds for whatever reasons, and your ask in terms of having a drive within our city limits. If you'll allow us to just get those things, that process in working for you, we would appreciate it, and we will absolutely be updating everyone on that endeavor. The demand for vaccines in our area has been overwhelming, and I am working tirelessly to ensure that every resident that qualifies for a vaccine at this particular time is provided that opportunity. The city is working diligently to bolster communication so everyone understands where we are in the process of the vaccine distribution, what's coming next, and how residents can prepare. We understand that people are waiting in line, and we thank our residents for their patience. We want to underscore there will be many, many more opportunities for our residents to be vaccinated. CCPD is helping us control traffic, and on behalf of the city, we want to thank our police officers for the support they are providing at the fairgrounds in Robstown, as well as our fire and EMS personnel. We are also, as I mentioned earlier, we're monitoring some weather, possible weather inclement that might disrupt what we are hoping to have on Thursday, but we'll keep you posted on that. We're also working to make our communications better for our residents so that you know exactly what to expect. What's to come? The City Council and I are working with our staff, the county, and the state on a Corpus Christi location, and as well as our fire department. That's extremely important that everyone know that we are diligently working for a senior and homebound program. We know it is very important that there are people who cannot wait in line, they cannot get to the fairgrounds, they're homebound, and we are actively and aggressively working on the logistics to create that program for you. So at this time, I think that's all we have, and we will welcome questions from the media.
Mañana miércoles 20 de enero del 2021 no habrá clínica de vacunación contra el COVID-19. El cargamento de la vacuna proveniente del estado aún no ha llegado y también estamos monitoreando el clima. Anticipamos una megaclínica de vacunación el jueves en el Centro de Exposición Richard Borchardt, donde nuestro objetivo es entregar 5,000 vacunas. Estamos trabajando para llevar a cabo la vacunación en un área dentro de los límites de la ciudad de Corpus Christi, para aquellas personas que no pueden ir a Robstown. La demanda de vacunas en nuestra área ha sido abrumadora y hacemos lo posible para asegurar que todos los residentes que califiquen para una vacuna en ese momento tengan esa oportunidad. La ciudad está trabajando diligentemente para reforzar la comunicación para que todos comprendan dónde estamos en el proceso de distribución de vacunas, lo que viene después y cómo los residentes pueden prepararse. Entendemos que las personas están esperando en la fila. Agradecemos a nuestros residentes por su paciencia. Queremos señalar que habrá muchas más oportunidades para que nuestros residentes se vacunen. El Departamento de Policía nos está ayudando a controlar el tráfico. Estamos monitoreando las condiciones climáticas. Estamos trabajando para mejorar nuestras comunicaciones para nuestros residentes para que sepan qué esperar. Y mientras también estamos planeando para el futuro. El Consejo Municipal y yo estamos trabajando con nuestro personal y el Estado en una ubicación en Corpus Christi. También intentamos coordinar un programa de transporte para personas mayores y nuestro Departamento de Bomberos está trabajando en un programa para las personas que se encuentran confinadas en su hogar.
Thank you. The mayor, the county judge, and myself are available if you have any questions.
I guess me jumping up 3 or 4 times indicates I do have a couple of questions. Bear with me, folks. Got a couple from the newsroom and myself. Let's start off, though, with what Mayor Guajardo ended her statements with the homebound seniors. Andrew interviewed you earlier today, and we were talking about a possible shuttle system. Is that part of the solution, possibly? Is that an idea of getting multiple seniors on a city bus or something and taking them out to the fairgrounds, or is that still?
Yeah, we're actually discussing what the logistics would be for something that could address our homebound, because they're seniors, they're homebound, or they're just homebound, either way. But right now, we're in those discussions. So as soon as we have something available, and we're working very hard to get it out, because we understand there's a great need. And so we'll get that out to you as soon as we have it.
So the details aren't exactly ironed
No,
out on
not
what we would
yet.
proceed with. So asking about multiple seniors in one van, say out to the fairgrounds, from a health standpoint,
Yeah.
we aren't at that point yet, because that's
We're
not
not.
necessarily the plan.
No, we're not yet. So we're trying to figure out how we can do it, how we can address this part of our community, because there definitely is one, and we've definitely heard their voices.
You mentioned the fire department. Is there a possibility of trained personnel going door to door in senior-heavy areas and administering the vaccine like that? Is that a thought?
Well, right now, the fire department would be part of this process. Yes, but again, the logistics are being worked out. Yes, sir.
Okay, and now we're talking about tiers 1A and 1B. When someone shows up at the vaccination, the mega drives, is anyone asking them if they are eligible to receive the vaccine, if they are in Tier 1A and Tier 1B? We're hearing that's not necessarily the case, and we were wanting to know why we weren't asking those questions.
No, we are not, because that actually slows down the process, and the state has asked us to vaccinate with a sense of urgency and has also asked us we could ask them to wear a badge if they're in the 1A, which we did. Some had badges, and we told the state this, and some did not. Some doctors' offices don't wear badges. So they said that doesn't stop you from vaccinating them. So again, we believe people that they're actually in the phase 1A and 1B, and we know that more phases are going to open. We believe it's going to be the 1C. Dr. Hellerstadt actually had a meeting with his EVAP panel on Monday to discuss 1C, but we also know that we still haven't reached the number of individuals that we have in our community that are 65 years of age and older, or those with comorbidities. So it's going to be weeks before the 1C phase opens, is what we're being told. But they asked us not to slow it down by trying to check credentials. Are you really asthmatic? Can you provide something from a physician? Because you're kind of defeating the purpose by doing that. You're sending them all back to a doctor's office to try to go get something which could put them in risk for actually picking up COVID-19 when they could come through our clinic and get vaccinated.
Okay, thank you very much, Ms. Rodriguez. Is Judge Canales still here? Do you have time for a couple of questions?
Yes, sir.
Okay, I'm going to read the question just
Yes,
because
sir.
these have been passed along to me. I want to make sure I get
Yes.
them absolutely right. They are COVID-19 related questions
Okay.
that were from the December 4th Commissioners Court meeting. I know it's been a few weeks, and so
Okay.
if we want to just refresh memories here. But it came up that Accenture was $150,000 over budget, apparently with a contract with the county. We were wanting to know what services they're providing. We think they're COVID-19 related. We're not sure. We would like to know what services they're providing and why they're over budget.
Sure. So they're not over budget. That's for starters. For starters, back in July, I believe it was July of 2020, we hired Accenture as our program manager. So they have been covering all of the responses that we have put forth for COVID-19. Everything that you could imagine, from testing all the way to vaccine management plans. They have a tremendous process that has helped us with reimbursements. And because of their diligence, we're actually able to pursue reimbursements with TDM. We have had a great success here in Nueces County, developing COVID clinics, alternate care sites, robust testing, not only within the community, but within the county itself and all the communities that we support, which means other political jurisdictions like the hospital district. We've put forth the social determinants of health through Accenture. That's working with Texas Health Institute. They are a global leader in healthcare as far as COVID-19 goes. They're helping about 7 different states from a coronavirus relief spending bill. They have been intimately involved with helping us assess which pieces of the bill. As you know, it's incredibly intricate, and they've been helping us on a national level as well, understanding the focus of that bill. And everything that they were hired for is not only reimbursable, but we just received a big step up. I think each TDM reimbursement that we put forth has a 7-step process, as you know, or maybe don't know. But I appreciate the question, and we receive biweekly reports. I've made them public. They are, we've also had multiple workshops where we invited the public, commissioners, city council. It's an excellent question, and I would love for more people to know how blessed we are, how privileged, and how exciting it is. Just a moment ago, I was sitting at my laptop, and I received a comment about our vaccination sites. And people are wondering how it's possible that we could be so successful and so efficient. And the answer is with great preparation. That preparation starts with a great team. At the county, we started off with myself and 3 other individuals in emergency management. Since that time, we've dealt with not one disaster, but multiple local disasters, including multiple weather events. So having them on our team is not only benefited our city county public health, but it's paid great dividends to the citizens of Nueces County. And if anybody has any questions, I'd invite them to Commissioners Court, and we can address those at a future Accenture workshop. But again, it's exciting to know that the state of Texas uses them, and so does Nueces County.
And the other question coming from the December 4th meeting was that I think it came out that essentially the expenses from the COVID clinic over by the old Spa Memorial have not been turned over to FEMA yet. Is that the case? And if so, why?
Sure. So you may remember that the state of Texas received a direct allocation from the feds of over $11 billion. But we here in Nueces County were given an allocation that came from the state valued at $55 per individual on our unincorporated citizenry. That meant that the city of Corpus Christi received $17.9 million, and we received $830,000. Because of that disparity on that allocation, we worked hand in hand with the city to develop a plan to share equitably some of the expenses, including the COVID clinic. So with regards to being over budget, so to speak, is we have an allocation that is a certain amount, and we have costs that have exceeded that allocation. However, the state of Texas has $2 billion that are extra for counties to be able to be utilized. So just this afternoon, I was visiting with the senator who is a member of the Finance Committee in the Senate, and we were talking about this very subject matter, that it is more important that TDM be given the opportunity to pay, and the state of Texas, to pay those bills because they are justified, they have saved lives, and they were eligible, and they were part of what we believe will be reimbursed by FEMA. But we'd like to pursue TDM first. Why? Because FEMA pays at a rate of 75-25, and the state of Texas pays 100%. So if Texas has $2 billion extra, and by the way, I've been told that counties collectively have gone over by $60 million, it seems to me a great investment if all of those expenses are justified expenses in the pursuit of saving lives for COVID-19. One would think that you would want to make sure that counties are made whole. So we advocated our position today, and we're no different than Laredo or Brownsville. But I appreciate the interest from, I'm sorry, your station is?
I'm with Chris 6.
Yeah, I'm not surprised. So Channel 6 is always very interested in posing these kinds of questions, and what I'd like to do is make certain that you guys have all the information that you need, because I would love to have more information being brought to the citizenry on this, because we need their help, because we deserve here to be reimbursed for our good efforts. Because when you are only given $830,000 and a county right to your south is given $150 million, we call that a disparity. But rather than complaining, we tried to solve our problems. And Accenture and Haggerty, another company that's helping us in disaster management, made that possible. So we turned $830,000 into $5.2 million. And for that, we say thank you to Accenture.
Just how confident are we that we'll be receiving those vaccines this week?
How certain? Is that what you asked? How certain?
How confident or certain?
Okay.
Either or.
You know, we're never confident anymore. After last week, we thought we were receiving vaccine at 10:30 because we had a shipment tracking number that said 10:30, and it didn't come until 2. Of course, that was weather related, and they had already told us that that could happen. So no, we're not completely certain. I felt like we really were going to receive the 5,000 doses soon, but again, this is Tuesday. We have no tracking information, so I don't expect it even to come tomorrow. And we always want to give the public a one-day lead. And so we're waiting just like everybody. And we're also reaching out to DSHS to ask them, Do you know when our 5,000 doses are coming? Because they asked us to be this vaccination hub, you know, and it would be nice to be able to receive vaccines. Any other questions? Seeing none, thank you so much for joining us for our press conference, and we will be back again next Tuesday at 5 p.m. Thank you.